As in the past, things have happened, as we're reminded of the Tuskegee experiment and different things. People want to know, and I think those are some of the things that are going around in the minds of our community. And these are real issues, right? Mm-hmm. But we have to not only trust God in these situations, but we do have to trust the science. I am gonna utilize some of that, some of that language, is that because that's what we have to go by right now. Yes, many feel that it hasn't been tested long enough, right? Normally, what, about 18 months or something to that effect. But we have to trust God and we have to trust the science. It really is maybe a huge act of stepping out on faith for many. And us in leadership being examples of that, I do believe still is key. And so we have to know that these rumors or these thoughts, they're real thoughts. And they are real. They're truths. People are just speaking their truth. Mm-hmm. And so it's very important for us to continue to receive information from the CDC, to continue to share the information with the community from the CDC, and to, when able, to provide the vaccine to our community, which is something that St. James United Methodist Church has been doing. We had a partnership with Truman, and we just did the second shot this week. For many, I think we're trying to do about 300 vaccines right now, and there may be another rotation coming eventually. Yeah. So we just have to continue to let people know that we get it. We understand. Some of it is fear, right? And it's legitimate. I mean, these are the truths of the people. But at some point, we have to make decisions to say, hey, I'm going to trust God and I'm going to trust science.
I'm glad that you're talking about trusting science, because that leads right into my next question, is that how do we as a federally qualified health center partner and have these strategic relationships with pastors, with other health officials to promote vaccination in your community? What works best when communicating that to the communities that are, one, dying most disproportionately from COVID-19, and two, are most at risk because of the fact that we have those frontline jobs, those essential jobs that have been essential throughout the pandemic?
Right. I think the first thing, Reverend Carter was exactly right in saying that personal example. So when we come up for our own, if you will, our number is called, I think it's important that civic leaders take the vaccine and let it be known. So educators are in phase 2 now in Kansas. And while we first did our K-12 educators, as they get to the end of phase 2, they're going to do higher ed. So I have received now my first shot because of that. This week, I have got the Pfizer vaccine. So I'll have a second shot later in March. So I'm letting people know that. Usually my medical history I don't talk about openly, but in this case I am, because I think we need to set that example. But we also do need to address those rumors. I was mentioning before we came live about a letter I have as a college president. It's called A Love Letter to Black America, from the America's Black doctors and nurses, many of them well known, including the president of Howard University, among others, who head of the Morehouse School of Medicine, some of the better known colleges and universities, asking African Americans to be vaccinated, trying to overcome some of that. But there's also, for example, 40% of my students are Latino in background, and there's concerns for some families about their immigration status and signing up for getting that. But I want everybody to know that the signing up for the COVID-19 vaccine in no way will jeopardize anybody because of their immigration status. and we're encouraging everybody to get the vaccine. It would be terrible for our community if people didn't get the vaccine because they were concerned about their immigration status. So I got to get that rumor. We got to address it. I think that's what we just have to do. We have to keep pounding the truth, both in word and deed. So we give the example, but we also have to get the word out.
Thank you so much, Monsignor Swetland, for bringing that up. I think Reverend Carter has been in multiple meetings where I talk about the refugees and the immigrants that live in our community. And Reverend Carter will know my soapbox is it in the language that people will understand? And is it going to be accessible to everyone in our community? Reverend Carter's smiling because this is a hot topic for me. So
absolutely.
Reverend Carter.
Yeah, that is absolutely true. And I think that's one of the things that we have to do. And in the faith community, we are communities of care. And one of the things I share with people, and somebody asked a question in the chat about, are all religions encouraging people to have the vaccines? And yes, I think most religions are encouraging people to have the vaccines because the information is there, the science is there. There are people who are involved who we trust and we believe in, and there are people of all hues. And so there is no rationale to not receive it. Some people say it came out too soon. Well, part of why we were able to have a vaccine sooner this time than we generally do is because of the research related back to the H1N1 and the other viruses that happened during the Obama administration. So there was a lot of research that was already out there, and the research and scientific community were able to benefit from that. And so it came out a little sooner. So there are just so many things, and we have to continue to just share with people that we are continuums of care. We care about people. And so even though I'm strong and robust, and I'm not talking about me, but another person is strong and robust, you have to be concerned not just about yourself, but we are also concerned about others. And so I do it, we did some PSAs. I got vaccinated, or I got tested so that my grandmother wouldn't get sick, or I got tested. So I have 12 grandbabies, and I keep telling folk that I don't want my grandbabies to get sick. I don't want them to be negatively impacted by this. And so I'm not just worried about me, I'm also worried about my concentric circle of contact and those people that I love and care about. And it requires us to communicate with people who are different than us. I think one of the things that the pandemic has done is forced us to realize just how much we are dependent on each other. And the virus impacts people in every circle. And so if we really care about people, and I think we're showing that, then we have to do the things that are necessary. And the vaccines right now is the best chance we have of lowering the numbers and getting back to some sense of normality.
Thank you.
And I just want to point out, just out of ecumenical sensitivities, that there are a few faith groups that do have a religious objection to any vaccination. Probably the most famous Christian Scientists, Church of Christ Scientists. So there are a few denominations out there, but the major denominations in our community are encouraging their faithful to be vaccinated.
Thank you, Monsignor Swetland. And thank you, Reverend Carter, for reminding us that we do have a chat available for questions and answers. Feel free to put those in the chat. Those are the question and answer box. And myself or any of the panelists can see that, as we learned just now. So feel free to put in your questions or any concerns that you have that way we can have a good discussion. So yeah, so we talked a little bit about your, the communities that you serve. We talked about the importance of promoting truth. We've talked about the importance of leading by example in your communities. Dr. McCall, did you have an answer to add into that? Because I realized I didn't check in with you.
No, ditto to everyone, what they said. I was just reminded, I was a chaplain still at the VA when all of this broke out. And as a healthcare worker, just thinking about the level of stress that I felt, and excuse me, and making sure that I got tested. I probably had about 3 or 4 tests within a particular time period, just making sure, like that I didn't bring something home to my family.
Mm-hmm.
And so having the vaccination would definitely eliminate, I think some stress for many people.
Yeah, and I think that while we're talking about the vaccination, we also have to remember, Dr. McCall, that we still need to continue to get tested as well. And we need to continue to wash our hands, right? And we need to continue to socially distance until we have everyone that needs to be vaccinated, until we go through those phases. So I want to talk about personally your commitment to promoting the vaccination. We've kind of been talking about that, but Reverend Carter, if you can talk to us, I know that we sit on a couple of different work groups. Can you talk a little bit about what's happening specifically in Wyandotte County for communities of color to have access to the vaccine?
Yes, I can, Mara. One of the things that happened very early on the Health Equity Task Force in Wyandotte County, we involved several of our faith leaders on that task force, and we've had access to the information. Personally, I had the opportunity to go to many of the pop-up sites and to help out and volunteer and to be involved. So I knew exactly what was going on. And the Health Equity Task Force has done a marvelous job, in my opinion, of reaching out and asking the question, who's not at the table, who should be here? There are some people that we sometimes forget. We don't do it purposely. We're just not thinking along those lines all the time. And so they've done a good job of reaching out and trying to involve different facets of the community to make sure that first and foremost, the faith-based community was involved. And because of the disparity related to the disproportionate way it affects the Black community, we made sure we had testing in those areas that was key to that. And they did a good job. And the churches responded by opening their doors and providing the pop-up testing sites and the FQHCs like Swope and Vibrant have been there to provide the workers who did what needed to be done. And so it was a very collaborative effort. The unified government has been involved, and we've reached out for grants. We made application for grants that have helped us to be able to do this. And right now we have something going with the RADx Up grant, which is the rapid diagnostic testing related to underserved populations. And Wyandotte County is leading 9 other counties in establishing local health equity action teams in 5 rural counties and 5 urban counties. And that work is ongoing, and it's making a difference in those communities because those other 9 counties can benefit from some of the things that we've already done. And so the collaborative efforts have been super, and the people have been great to work with. We build relationships that I think will last a lifetime, even though now we've been working together almost a year. And so there are so many benefits. To some degree, the Health Equity Task Force has been the fellowship that I need, has come to a large degree through the Health Equity Task Force. So I miss seeing the people at church. It's hard preaching to a bunch of empty pews, but we adjust because it's the safest thing we can do now until more and more of our population is vaccinated, and we can then begin to consider coming back together. Hope I didn't talk too much.
Oh, no.
I could just chime in. We too have grants. I want to shout out to our Community Engagement Director, Yvette Richards, who is amazing. And we have a partnership. We've partnered with Truman Medical, and we have also been a testing site, and we are also currently doing the vaccinations as well. And one of the ways that we make sure that we spread the word to the community is every worship service, we've been streaming live. There's an ad in our worship service that talks about the COVID-19 vaccine, that talks about ways to remain safe, wash your hands, social distance, wear a mask, those sorts of things. And also for our outreach endeavors, like our food distributions, which are still going on. And we hand out literature about the COVID-19 virus. And I think now also to the community when the vaccines are available. So just trying to utilize what we can and talk about it when we can in service and in our outreach endeavors.
Wonderful. We just got a question here from Mark Miller. He is our senior leadership member that is responsible for behavioral health. And his question reads, what are some of the mental health concerns, stress, anxiety about COVID that you guys as presenters are seeing in our communities?
All right. Well, for us at the college, this has been a major concern. We've done and allowed our mental health practitioners to work with people online. Some work can be done that way. We still think it's more efficient when we're in person. So we're glad that we're back in person. But the two that I've seen the most is what I call Covet fatigue, which is just the stress leads to a general fatigue, which can also lead people to be tempted to cut corners on the hygiene issues that we should all keep vigilant on, wearing masks, the things we've talked about today, wearing masks, proper use of hand sanitizer, frequent washing of hands, all the things that we would do, keeping social distance. So we have to persevere to the end. So this is where faith leaders can talk about the virtue of perseverance and fighting the good fight through the end. On a natural level, I would say track coaches talk about running through the tape. So we have to encourage people to run through. The end is in sight, I think. We just need to encourage people. So there's that. But there's also, because we are so distant from one another and we're not having the kind of mental health boosts that might come from a normal vacation, or a normal perhaps time out with friends, going to the movies, whatever we do for our own mental health, that we do have to be cognizant, like days like this when it's in its 70s or high 60s, to take a walk outside, to be aware of more picking up the phone to call each other, to visit each other, keep the human interactions, especially for anybody in our communities that might be isolated. I think it's very important. And I know that for the young, it's just as important as for those who are older.
Thank you, Monsignor.
Yeah. Yeah, it's, having talked to several members, I hear all the time, I just miss, I just miss you. I just miss going into the church building. I just miss, the fellowship. And it is causing some people anxiety and loneliness, because, you don't forget about members who are widows and do not have children. Church oftentimes, for example, is a huge, it's, fictive kinship, like an extended family for them and family, for them. So not having that is causing a void for many people. And so, yes, with that, lots of times and then people are experiencing deaths, right? People are dying. And so people are questioning, so people's spirituality, it's also being affected. And so it's been very important. For example, for me, we've been doing growth groups online. It's very important to kind of keep some of these things going, because there are definitely some individuals, if they did not have that one thing, that one additional thing, they would not be well. So it's a lot of people experiencing anxiety, loneliness. I've heard all of this language. Some people are even choosing to find churches that have a drive-up service, just so that they can be around other people if their church isn't having in person or any type of live anything. So it's definitely a time where we have to be creative to try to keep people engaged. Whether that's a robocall, just so they can hear that, yes, we care about you, we're thinking about you. Something in the mail, just something so they can have that touch point. Because there are people who truly rely on things like church, for example, for relationship, because they don't have other relationships to lean on. And so it can be extremely lonely for many.
Yeah.
Mari, one of the things that funerals, and I'll be brief, funerals are a way of expressing our love and showing our love for our members. And now that only the immediate family can go to funerals, and sometimes all of them can't go, one of the things that we have started doing, and I have to credit Sister Rose Montgomery, who I think originally had this idea, but the church members who want to support the family who lost a loved one, they drive out in front of the church so that when they exit to go to the gravesite, they are out there with signs and balloons and wave at people. Reverend McCall said we have to be creative. That's one of the things that we've been able to do that certainly makes that family who's coming out of the church and still grieving, it makes them feel good because they see that their members care about them. And those are the kind of things we have to do to maintain that connectivity and make sure that we are looking for other ways to commune one with another.
Thank you, Reverend Carter. You know that I'm a crybaby. You can't just throw out those emotional details like that. I'm gonna tear up in front of all of our associates.
We need each other. We're supposed to share. It's good. That's the whole rationale for doing this.
Yeah. So I just saw I saw a question here by Ruthie Warcuff. Ruthie, it works in our behavioral health department, and she is also she's a minister herself, and she's one of our associates. And her concern, which is very interesting, very Ruthie, is how are you reaching young people in your church? And before you answer that, no, go ahead and answer that, and then we'll talk about my next point that I have written down here. So how are you reaching out to young people during this COVID time?
I can share. It has been tough. I will admit it has been tough. And it is definitely has been a need. One of the things that I will say that we kind of finally, let me take that back. We have had different outreach kind of events during the fall. The children did go out to the cornfield out there in Liberty, where they could have a bonfire and kind of just be out there with one another, the Girl Scout troop and all of them. We have kind of tried to continue to have activities for the children kind of on a monthly basis, outreach kind of thing. We also, but it's different. It's just different.
It's totally.
It's just different. We also, in January, we did a vision board Zoom with the children. So we made sure that the children, that's why I said you got to get creative, right? We made sure that the children, we got supplies. We had a pickup time where people can come by the church and pick up supplies. And they came by and got supplies. We also have mailers that have gone out to the children with kits for Advent, for Lent, for the Lenten season now. They have a kit for things for them to work on. So utilizing the mail and trying to still find socially distanced types of things for the kids to do has been really key. And every now and then, if we can do some type of Zoom, like the vision board Zoom, we're putting that in there. So yeah, creativity.
Yeah, I don't have much to add because I don't run a parish. I help out, and I know that we have done some of the outdoor things. Like I'll be going in April down to Camp Tekakwitha, which is a Catholic-run camp, where they're gathering a lot of people because they can and keep them socially distanced and have an outdoor experience. But this is actually a real challenge for religious leaders. The current generation is not as church, to use that term, as previous generations. If you look at the United States, comparing it to Europe, for example, we are much more likely as a whole to go to church than people in Europe. But if you look at the generation that's now called Gen Z, their numbers are getting more like the Europeans when it comes to how many are involved actively in church activity. So all of us, no matter what denomination, and this is true even outside the Christian churches, when I talk to my rabbi friends or talk to my friends who are involved in Islam, they're having the same issues. So this is something we all got to get better at. Now, as a college, we try to do things here that open our students up to thinking about their relationship with God and about their vocation, their calling. I think is at that stage in life when they're younger is when they're looking to figure out where they fit in the world and what it is they're called to do. So we talk a lot here about vocation. It comes from Latin vocare, means calling, and that immediately leads people to the question of discernment. Were they made for something in particular, which we as Christian believers believe they were made for a particular purpose.
So, in talking about your purpose, and Reverend Carter, I'm sorry, were you going to add something?
Well, I was just going to say that has been the most crucial and critical challenge that we've had. We tried to make Zoom, on Zoom calls, you can put folks in different rooms, and we've tried to continue to do Sunday school through Zoom. That hasn't worked. And so, that's a challenge. I wasn't going to say anything because for the most part, it doesn't look like we're doing anything because we're not making any progress. I continue to pray for all of our young people. I try to call on occasion and talk to them just like I do with the seniors, but we just try to maintain that connectivity. But that has been the biggest challenge. I think initially they were impacted by jobs. And so that was their initial concern. And then once things started to settle back down, if you hadn't been in a few Sundays, you know how we are, that generation that Monsignor Swetland was talking about, those generations behind us. If you miss a few Sundays, it's easy to add a couple more to it. And then when you can say, well, I ain't going to the church no way, it's easier. And so it's been a challenge for us, to say the least.
Thank you, Ms. Ruthie, for that thoughtful question. I think it got us talking a little bit more about these important ways of how we can continue to engage with our community. And I want to steer us back to our charge, right? As a federally qualified health center, our charge is to provide quality health services to those who are underserved, underinsured, or uninsured. And, we have a plethora of ways that we do that, a plethora of different services that we provide. We try to really be a medical home. So, and you all have very specific charges, right? Monsignor Swetland, you're responsible for your students and your faculty members. Reverend Carter, you're responsible for your members of your church, as well as Reverend McCall. How do we, as community leaders, really get together in order to, one, promote vaccination, and then two, how do we have those conversations to make sure that we're getting that vaccine that we need in order to vaccinate our communities? I know that's a really dense question.
Well, again, I think it's important for us to lead by example. And so letting people see that we're being vaccinated is one thing, and then to try to address all of the concerns and issues that they have. There are people who aren't able to get to the sites where there is vaccinations. And so we're trying to be innovative about making sure that there's transportation available. The Health Equity Task Force and the Unified Government are providing mobile testing and vaccinations. And so I think that's another way that we are trying to promote it. But I just think that we've got to get away from fear. You know, the scripture says that God did not give us a spirit of fear. And we usually just stop right there. But he also gives us a sound mind. And so we have to continue to encourage people to get all of the facts and to help them to see how important it is for as many of us as possible to get vaccinated, because that's the best chance for this thing to plateau and for us to be able to get back to doing things. I want to get out of, I work so much harder, and I don't know if this is the same for Reverend McCall and Monsignor Swetland, but I work probably 5 to 7 times harder trying to do this stuff virtually. And the preparation is, I want us to get back to normal so I can get some rest.
Can't agree with you more. And I'm new to the Kansas City area. I joined, my campus, I haven't even had an opportunity to meet every single member because I came during COVID. So it's just been difficult. It's been a lot. It's been a lot. So my prayer is that, we all go ahead and get vaccinated and go ahead and, so we can be in fellowship with one another again.
Absolutely.
Sure.
Yeah, and I would only add that there have been some concerns about how some of the vaccines were derived and tested and developed. This has caused part of the Catholic community to be concerned because of our witness to what we believe is a very important part of our community, which is preborn human persons. I wish the vaccines were all developed without the use of stem cells derived from abortions, even though we're pretty remotely removed from the time when those abortions took place many decades ago. But our bishops have made it clear, even the Vatican has weighed in on this, that Catholics are encouraged to get the vaccine, despite our concerns. If available, we would like to take the vaccine, which is unconnected to these procedures. But if the vaccine that's presented to us has been tested, that's a remote. So like I said, I've already outed myself. I took the Pfizer, which was tested using the stem cell line that was derived from an aborted fetus. I wish that hadn't happened, but it is remote and it's still for the common good that we can take the vaccines. So our bishops have encouraged us to take the vaccine, and I think that's an important thing for our spiritual leaders to do. But at the same time, as a nation, I think we need to step back and say, is there ways we can create vaccines that don't have these ethical issues?
Yes.
Because it does affect believers in a particular way.
Absolutely.
Thank you for that. I know that you mentioned the common good, and I wanted to bring that back up. And so I guess as a health care provider in Kansas City, we need to, the common good is for people to get vaccinated, and we want to be, available once the vaccine is here and in Kansas City. And we have already opened up a vaccination clinic here in Missouri. And we do have the fact that the phases are different in Missouri versus Kansas. And that's something that we have to navigate, right? And we want everyone to have the right information. But we are vaccinating at our location at the 4401 Blue Parkway. We are vaccinating those who are 65 and older in the community, and they're able to access through vaccine navigator and are able to access the vaccine there. And partnering and having these conversations is absolutely crucial, so your communities know where they can get vaccinated, so your communities know that we are trying to help our community in this way. I see someone with their hand up. Christine, if you have a question, please go ahead and type it in the chat so the panelists and I can see it. So yeah, the common good is to get vaccinated. The important thing is to have access to good information, and where we access that, and how you guys are definitely being champions for this good information, making sure that our communities stay safe and continue to stay healthy. We are about nearing our time, and I know that we all can be long-winded and like to talk. Maybe there's a joke about pastors taking a long time. Sorry.
I resemble that statement.
Well, and I only say it, Reverend Carter, because we have such a good relationship, Monsignor Swetland and Reverend McCall. It's fine. We're all friends here. But, when we're talking about encouraging people in at-risk communities to access the vaccine, what is important for our providers to know in talking to those that you serve and encouraging the vaccine? What language and how do we encourage those in our community to get the vaccine?
I would say one of the things that just comes to mind is a gentleness with working with the community. When people come in to get the vaccine, I think it's important for the providers to be gentle and to be kind and understanding, because many people don't want to get it. They're there because they know they need to get it, not because they want to get it. Mm-hmm. And so just being gentle and kind and understanding and patient with people, I think that it will go a long way.
I agree 100% with Reverend McCall, and I think we're saying the same thing, and maybe I'm saying it a little different, but I think people need empathy. We need people who are empathetic, who are able to place themselves in another person who maybe don't see things the same way, maybe don't have the same advantages we do, who maybe don't have as much access as we do. But we need to see things from their perspective, and in so doing, be gentle and try to understand what that other person may be going through.
Yeah, and I would just add the solidarity that we're in this together. So we need to encourage one another, but also that may mean, helping a neighbor or helping a relative go and get the vaccine and be there for that aftercare that might be involved. There are some side effects that people, have, especially when you get the second dose. I've been told, I've had the first and there was the usual sore arm and kind of achiness, but I understand when you get the second dose, for some that can make it difficult. So just that solidarity that we're in this together and help each other, because what we want to build is true trust again as a community. We've got a long way to go in our community here in Kansas City to build real trust between various parts of our community. And this is a good opportunity. We've had a setback because of COVID-19. Now we can take advantage of that setback if we can really reach in and start working with each other across whatever barriers. And that will build up that virtue of solidarity in our community.
Absolutely. Thank you. Yeah. So we're all in this together. And I just want to ask if there's anything that we didn't cover that you really wanted to share, pretending that there's a room full of providers and people that are very interested in making sure that our community continues to be healthy. And you want to share with everyone on our live and our associates here at Swope Health.
Well, I just want to thank you for the work you're all doing and all your cooperators. But there are so many questions. That's the one thing I'm hearing. So I think we just, one thing about building trust is everyone's going to have to be patient with the questions people ask. And I think that's going to help build up more readiness to take the vaccine if they've got their questions answered.
Yeah. And I think that's part of why we're doing things like this, right? That's the reason why we've had Dr. Glenn. That's the reason why we're having a conversation with what I would call community experts, because we want people's questions to be answered. We want people that once we have vaccine available, we want to be able to vaccinate people as quickly, as efficiently as possible, because we want everyone to be healthy and we want to get back to normal, whatever normal looks like in the future. Reverend Carter, Reverend McCall, sorry.
Well, again, I appreciate the opportunity, Maury, to work with you, and Swope has been phenomenal and vibrant, and all of those others. I think I need to say thank you to all of the people who we have the privilege of working with on a regular basis. Dr. Alan Griner, Dr. Aaron Corvo. I mean, there's just so many. I almost hate to start calling names, so then you forget somebody. Terry Garrison, the epidemiologist. Julianne Van Loo with Unified Government, Janelle, Monk Sono, who works with the immigrant and refugee population, Pastor Brady from New Bethel, Pastor Turner from Oak Ridge, and there are just so many people who have been working together, who have selflessly given of themselves, and they are to be commended. And I know I left out a dozen other names, but I appreciate all of them, and I love them, and I'm just so honored to be, to some degree, representing them in a small way.
Yeah, I too would just say bravo, bravo, excellent job to everybody, all the first responders, all the essential workers. Thank you, thank you, thank you from the bottom of our hearts. I mean, I would just say thank you. And I would encourage maybe just reach out to the various, like the churches, to say, hey, is there a spot for me to maybe set up? Once we're back in the building, maybe there could be a station outside, just continuing to answer questions and to provide resources, more resources as to where they can go and that sort of thing. Or if we're still streaming, maybe, we can invite you to be part of a video ad where you can, every Sunday answer a question. We can just have up on the screen, a video of you answering a question, a provider answering a question. So there are lots of ways, but I would just, first of all, I would just say thank you.
Yeah. Well, we are at our time. I want to thank all of you for, one, your commitment to our community, for making sure that our community continues to be healthy, for the leadership that you all show in the community, and for this commitment to, as soon as more vaccine is available, we continue to vaccinate those in our community who are most vulnerable, and also those who are healthy and et cetera. Monsignor Swetland already shared with us that he got vaccinated, and I'm lucky enough, and all of our associates had the opportunity to get vaccinated as well, those who chose to be vaccinated. So I fall in that category that Monsignor Swetland was talking about, that they're kind of invincible. And I still took the greater good, the common good, and got vaccinated. So I want to thank you guys for your time and your dedication to our communities. I truly appreciate all of you. I get to see some of you more than others, Reverend Carter and Monsignor Swetland. I get to see you occasionally, so that's really great. And Reverend McCall, I'm sure one of these days we'll get to meet in person. Thank you for the time that you spent with our associates. I'm going to quickly share my screen one more time and remind those that are struggling with any mental health issues during this time, any depression, anxiety, who need those coping skills, to please feel free to reach out to 1-800-985-5990 and call our disaster distress helpline. We are here to help and serve you during these times. Thank you very much. And this is the conclusion of our time. Take care.
Bye.
Nice to meet you, Sister Reverend McCall.
Oh, likewise, likewise.
Welcome to Kansas City.
Thank you. Thank you. I'm loving it here.